Hey guys, welcome back to Contest Prep University. I'm Klemczewski with Adam Atkinson. We are going to wrap up our series on cardio today, talking about the training considerations, which we've touched on in a couple episodes, but primarily some of the ways that you may need to modify your cardio. And I'll throw out one, Adam, in the fact that I'm pretty sensitive to things because I've had a pretty severe IT band syndrome in my upper hip area, trochanter area. I've had this running chronic issue with a piriformis on the same side. So sometimes I just know, hey, this is not the day to sprint, or maybe I need to take a couple weeks off and kind of de-escalate my intensity a little bit. But besides injuries, what are some other things that you might modify cardio prescription around?
Yeah, I have a great case. I have a client who's a breast cancer survivor. She is on letrozole, which, if people don't know, it's an AI that completely eliminates estrogen in her body. So we have a lot of bone density concerns. She's getting blood tests every 2 months that I look at, and we look at her bone density. But her last coach was just murdering her with HIIT, and it was really affecting her body, her recovery. And you need estrogen to mobilize body fat. That's something that a lot of people don't think about. So we've really gone low intensity route with her. And when we do HIIT, it usually is a type of rope swing, something that's very low impact. And we've got her doing those like twice a week right now. Pretty short bursts. This lady's a little bit more mature, in her 50s. And this has been great for her, and she feels so much better. She's recovering better for her training sessions. Obviously, there's a lot of hand-holding with that, but it really is important, and it makes that big of a difference when you have someone with so many needs like that.
Do you use low-intensity work but higher resistance to decrease bone impact but still try and build bone density?
So she does have access to an assault bike and a Concept 2 rower, so we have utilized those quite a bit. And she lives where it's pretty warm right now, so we've actually allowed her to get outside as well for some of those less intense cardio sessions.
Mm-hmm. And the reason I thought of that is I know on my personal elliptical, there's a huge difference, and I would challenge everybody to really experiment with this. If I'm on an intensity level, a resistance level that I can, really get after the speed, that's way different than if I triple the intensity to where it's just like grinding. It's like almost, you're in the lowest gear going up a mountain. And that is way harder because there's so much more muscular output. But again, you can't do that forever either. That almost creates kind of a high intensity interval. But at the same time, you could find that sweet spot in the middle, or if the speed and the repetition and the pounding on joints is just not effective, then find something like the rower, the elliptical, the assault bike, where you can increase resistance and just work a little bit harder, but without that kind of intensity or speed, and you will absolutely get your heart rate up, which, going back to the studies I mentioned earlier regarding epinephrine and growth hormone, that's where you secrete more of those anyway. This goes all the way back to early studies, I think in the maybe 60s or 70s, by Arthur Jones and people, who looked at the growth hormone response and how you have to use more muscle tissue. Those are really the beginnings of functional training. And a lot of people just don't realize how, if you're just doing one motion, like running or biking, how really limiting that can be on what you could be deriving from your cardio.
Yeah, absolutely.
So when it comes down to the other types of training considerations, I think we've covered this thoroughly in terms of, not being too sore or that kind of thing. But are there any other things, Adam, that you look at in terms of saying, hey, you probably shouldn't do this, or on this day, do this only for these reasons? Or how specific do you get?
Yeah, a lot of it comes back to the biofeedback of the client. How's their recovery? If they're recovering great, we will leave things alone. I don't know if you've seen this, but with COVID-19, a lot of people don't have access to their machines like they used to. I'm seeing a lot of shin splints right now. So we're doing a lot of moving around with things. First teaching people how to mitigate the issue in the first place, but the difference of running on a treadmill and having that almost cushion with the almost spring-like effect it has compared to running on pavement is completely different. and people are getting pretty beat up from that. So I've had to pull back and just teach people how to do cardio a little bit differently right now.
You know, what's funny is every time I think I'm stumping you with a question, sometimes I think of something, I'm like, well, I don't know, this may not be one that we should throw out here in a podcast. You always come up with the perfect answer. So I think that's amazing. Always listen to the client. I mean, you should always, as a client, as a competitor, listen to your own body and just consider, am I really recovering? Why is this not working? I should be able to do this. Just really experiment. Spend some time jotting down those notes and go back through this series again and break up your cardio schedule for in that steady state versus interval. And then between those two categories, you can do low intensity, moderate, or high intensity, whether it's interval or steady state. So thank you, Adam, for this. I think this is a great series, and we'll see you guys next time in Contest Prep University.